Hi, I'm Dr. Lakshmi Srinivasan, fertility specialist from Apollo Fertility, Karapakkam, Chennai. See, most of patients during IVF, the first question they ask is how to increase the success rate of IVF. In previous video, we saw how they could increase their success rate. Now, I would tell you what we do in our lab to improve your success rate. Now, even before we start the IVF treatment for the patient, we evaluate them deep. We correct all the correctable factors, what all will improve the success. We do it prior to starting the treatment. See, if we find any uterine abnormalities or any uterus lining abnormalities, we correct them prior by surgery, like simple surgeries like hysteroscopy or laparoscopy. Some women may have tubal distension, fallopian tube distension with fluid, what we call as hydrosalpinx. We correct that prior to we start the IVF treatment. Next, if we find that they have low ovarian reserve, we do put them on certain medications which will improve their egg quality. Similarly, if the men have poor counts or the morphology is abnormal, we give them certain medications to improve those, because a good egg and a good sperm is necessary for a good embryo and an optimal higher success rate. Next, going to the lab per se. The first thing is a high standards in the IVF lab. We ensure that the high standards are always maintained to optimize your success. The other things is the state-of-the-art technologies we have in our lab. The MC technology. See, there are two technologies, the HC or the MC. These two technologies are necessary for selecting the best sperm. In HC, we are able to magnify and have a look at the sperm almost 400 times. Whereas in MC, it's the higher technology where the magnification goes more than 6,000 times. So we're able to select the most normally appearing sperm so that it improves the fertilization rate and the embryo formation rate and the success rate. The other technology is a laser assisted hatching and embryo glue. Now, once the embryos are formed, we put it inside the uterus. So these two technologies, what happens once we put the embryos inside, sometimes if the eggshell is too thick, the embryo may not be able to hatch out of the eggshell and implant in the uterus. So to address this problem, we create tiny holes in the eggshell. This will help in hatching of the embryos and improves the implantation. Now, the embryo glue is a special media which helps to increase the interaction between the embryo and the uterus lining and improves the implantation rate. Then we have a technology called pre-implantation genetic testing. Short, we call it PGT. Now, generally the embryo assessment is done by clinically looking at it. That is the morphology of the embryo. That is how equally they've divided, what time they've taken to divide. All that is a usual assessment, but we do not know the genetic potential of that embryo. Whereas in PGT, we get to know whether the embryo is normal or abnormal. So once we choose the normal embryo and put it inside the uterus, the implantation rate and the success rate is high. So, by ensuring high standards in the IVF lab and by using state-of-the-art technologies, we ensure you that you get your highest success in IVF. Thank you.